This was me 1 year ago. And when I stumbled across sadness on my journey, this is me now. Eating has been my coping mechanisms ever since.
When we know one angle and one side. Now the first step is always to identify which sides are involved.
Seem like no one's listening.
Slow speech are characterized by the poor pronunciation of words, mumbling, or a change in speed or rhythm during a conversation. The human voice is intricately linked with the endocrine system of the individuals. The human voice is susceptible to the hormonal changes throughout life right from the puberty until senescence. Dry skin is an uncomfortable condition marked by scaling, itching, and cracking. It can occur for a variety of reasons. Severe dry skin is caused when no or very little sebum is naturally produced by the skin, leaving the skin severely lacking in moisture.
Assessment of the client with thyroid disease. Subjective data. The patient complains progressive gain weight of 1 year, fatigue, postural dizziness, loss of memory, slow speech, deepening of voice, dry skin, constipation, and cold intolerance. Objective data. Moderately obese, slurred speech, puffy face, pale, cool, dry, and thick skin, thyroid gland not palpable, and deep tendon reflex time delayed. Vital signs are the following. Temperature is 36 degrees Celsius, pulse rate 58 beats per minute, blood pressure is 110/60. Now, let's proceed to diagnosis. Risk for secondary hyperthyroidism related to a deep voice, delayed Achilles tendon reflex time, brachycardia. For the planning, after 8 hours of intervention, the patient will demonstrate an increased activity tolerance, improvement in speech and healthy skin, maintain pulse rate within acceptable range.
For the intervention, the independent roles are monitor and assess vital signs, provide comfort measures, instruct the client to relax, to reduce stress stimulation, maintain activity restriction, monitor response to medication to control the signs of allergic reactions, wait daily, and observe for intolerably pale, cool, dry, and thick skin. For collaboration, administer levothyroxine as indicated and implement increased iodine intake. For the evaluation, after 8 hours of intervention, the patient was able to maintain its vital signs in acceptable range as evidenced by a normal BP, which is 120 over 80 millimeters of mercury, and normal pulse rate to 60 to 180 beats per minute. And the patient also shows increased activity tolerance and improves thought processes and demonstrate good and healthy skin.
Name of drug. Generic name is levothyroxine. The brand name is Centroid. Dosage, route, frequency, and timing. For adult, dosage should be 12.5 to 25 mcg. Route is PO or by mouth. Frequency every 4 to 6 weeks. Timing before breakfast. Mechanism of action. Levothyroxine is a synthetically prepared levoisomer of the thyroid hormone thyroxine, T4, a tetraiodinated tyrosine derivative that act as a replacement in deficiency syndrome such as hypothyroidism. T4 is the major hormone secreted from the thyroid gland and is chemically identical to the naturally secreted T4. It increases metabolic rate, decreases thyroid-stimulating hormone TSH production from the anterior lobe of the pituitary gland, and in peripheral tissues is converted to T3. Thyroid hormone increases the metabolic rate of cells of all tissues in the body. In the fetus and newborn, thyroid hormone is important for the growth and development of all tissues including bones and the brain. In adults, thyroid hormone helps to maintain brain function, food metabolism, and body temperature. Among other effects, the symptoms of thyroid deficiency relieved by levothyroxine include slow speech, lack of energy, weight gain, hair loss, dry thick skin, and unusual sensitivity to cold. Indication. Levothyroxine is indicated as a replacement therapy in primary, the thyroidal, secondary, the pituitary, and tertiary, hypothalamic congenital or acquired hypothyroidism. It is also indicated as an adjunct surgery and radioiodine therapy in the management of thyrotropin-dependent well-differentiated thyroid cancer.
For contraindications, it is contraindicated in hypersensitivity, recent myocardial infarction, hyperthyroidism, use cautiously in cardiovascular disease, initiate therapy with lower doses, then severe renal insufficiency, and uncorrected adrenocortical disorders. So for the adverse effects, possible adverse effects include agranulocytosis, cardiovascular changes, which is the shortening of systolic time intervals, increased frequency of atrial premature beats, and possibly left ventricular hypertrophy, and bone changes, which is the reduced bone density and bone mass, but the risk of these adverse effects can be minimized by carefully monitoring serum, free thyroxine, and free lipotyronine measurements and adjusting the dosage accordingly.
So, special precaution. Use cautiously in pregnancy or lactation. Use is contraindicated for clients who have thyrotoxicosis because of cardiac stimulant effects. Use is contraindicated following a MI. Use cautiously in clients who have cardiovascular problems like hypertension, angina pectoris, ischemic heart disease because of the cardiac stimulant effects, and in older adults. Thyroid hormones replacement is not for use in the treatment of obesity. Nursing responsibilities and considerations. Instruct client to take daily on an empty stomach before breakfast daily. Provide client education regarding the importance of lifelong replacement even after improvement of symptoms. Advise clients not to discontinue the medication without checking with the provider. Then instruct clients to check with the provider before switching to another brand of levothyroxine because some concerns regarding interchangeability of brands has been raised and dosage adjustments may be necessary.